Okay, so why did I choose my arm and not my leg for phalloplasty? Just a quick recap, I had RFF phalloplasty, radial forearm flap phalloplasty with Dr. Meng Chen. I had stage 1 in November of 2021, stage 2 in May of 2022, and stage 3 in November of 2022. So when I was in the preparation process and I was consulting with my surgeon, Dr. Chen, we discussed which option would be best for me. Now, I initially did want to go with my thigh because I didn't want to have a scar on my arm. My surgeon took a graft from my arm and created my phallus, and then he took a thinner graft from my thigh and replaced it and put it on my arm. So this is actually technically my leg, and that's my arm. I originally wanted to go with my thigh because I didn't want to have a big arm scar, especially because with the way that I scar, my scars are, they keloid, they are waxy, and they get pretty dark, even if I apply sunscreen. But we did a pinch test on my thighs, and at the time, my surgeon said that there was way too much fat on my thighs, that I would end up with the girth of a Coke can. I know it's not the best way to explain it, but that's how he explained it to me, just to help me kind of visualize what I would be having in my pants all day long. Some guys want a lot of girth. For me personally, I just didn't want that size in my pants all day long because I'm also very physically active. I'm in front of the camera a lot. I'm not just having sexy time all day long like I do other things. So I also went with my arm because there was a better chance or a higher chance of me having more sensitivity. The arm has more sensation than the leg does, typically. Also, the skin on the arm is thinner. So yeah, I went with the arm just because I felt like I had a better chance at having more sensation, and also it was closer to the size that I wanted aesthetically. So like I said, he took this to build my phallus. He also took a section from this area to create the urethra so that I could have urethral lengthening. And then this scar here is from where they went in to grab a nerve and a vein. So what they do is, it's called a nerve hookup. Now, Dr. Chen does have a video up on YouTube where he talks about kind of like explaining the process of surgery. It is graphic if you do look it up, but he specifically says that the nerve that they take, and I'm gonna look at it because I'm probably gonna say it wrong, is the lateral antebrachial cutaneous nerve. It's a sensory nerve, and so they take that sensory nerve and they hook it up to the dorsal nerve that is down there. And then the nerves kind of do their thing, connect, regenerate, and then that leads to sensation. And then the vein that they took, they basically attach it to the phallus and then they hook it up to the femoral artery. So my phallus has blood supply. It actually pulses. In the hospital, it was really cool because they put an ultrasound on it and it had a little heartbeat. It's alive! So it's alive, it's warm. As far as feeling goes, I can feel tactile sensation, erotic sensation, temperature, pain, pressure, and some parts are more sensitive than others. The way that it worked out for me is the tip is actually the most sensitive part, which is very affirming. So for me, tactile sensation did start to come in at 9 weeks. However, 2 weeks and 3 days post-op, I had a hands-free. And it was, I didn't even do anything. It just happened. I just like woke up and it was happening. And that was amazing for me because then it just showed like, oh, I can still climax. I can still have that. And it felt amazing. So my sensation down there is really good. It's actually, it continues to change and it continues to grow. And it's coming in more and more in different parts. So for me, the experience is kind of always changing and I love it. I have a lot of sensation. Everything down there is very sensitive, especially the huevos. As far as the sensation on my arm goes, there are parts that I can feel more than others. This I can sort of feel, but it's just like, it's kind of hard to describe, but I can't feel it fully. If I use my fingernails, I can feel it a lot more. Same with this area. I can feel right here better, also because I feel like the scar isn't as waxy here. But if I use my fingernails, I feel it more. And then there's just some sections that are like completely numb in spots. And then this spot right here along my radius is extremely sensitive. It feels like, it's that feeling you get when you hit your funny bone and it kind of radiates. It radiates into my hand, like right here. I don't want this video to be too long, so in another video I will cover mobility, hand therapy. I'll also go more in depth into the stages and what happens during each stage. All right, I hope that helps. And if you have any other questions, go ahead and put them down in the comments.